I'm General Velu Nair. I head the Apollo Cancer Center in Ahmedabad, Apollo Hospitals International Limited. And we have a team structure of clinical hematology and bone marrow transplantation, medical oncology, surgical oncology, and radiation oncology. We not only are doing our practical practice, but we also have we're a teaching hospital, and we run DRNB courses in all these subjects. And we have a state-of-the-art unit, and we run all these 4 verticals very efficiently in one of the best units in the western part of our country. I think bone marrow transplant program in India has come of age now. We started in 1983, and for the next decade or two, we only had a handful of centers. And I remember in 2003, we were still talking of 10 to 12 centers. And as of today, we are talking of more than 115 centers. And we have now got data through the Indian Society of Blood and Marrow Transplantation. So we know facts and figures which we didn't know yesterday. But the challenges which we face are actually quite a few even now. Because we have transplantation in the public sector, in the private sector, in certain trust hospitals, and all these have different challenges. And the challenges with the private sector and the corporate sector faces is, especially support from the government and support from the state officials in actually helping us get all the clearances, and also to get some sort of subsidies in place for the below poverty line patients. So large number of patients are being treated by the corporate today. So to make it possible, I think we need to also see how we're going to support the costs. And to support the cost today, I must say that the state and central government do give some financial support. There is NGOs who give support, and there are certain CSR, corporate social responsibility, like Coal India, who sponsor patients for treatment, and there are more people coming up on this. So it's become easier than before. Last but not the least, the insurance players in the country. It has to come up. There are still gaps in where it should be and where we are. But I can safely say we have made a beginning and we made a start. But most patients sometimes don't get covered wholly for their transplant when they come up for such a procedure in our hospitals. Yes, I think it's a very good question and a very important one. Firstly is to diagnose early so that you know where to go. Number 2, you should be able to say by prognostication who needs transplant and who doesn't need transplant. And don't waste time if you need transplant in making them spend money for chemotherapy, radiotherapy. Take them up at the earliest. Number 3, have a good referral system by which they are referred early to you for the transplant. And number 4, use advanced, refined protocols, which mostly are available in our country. Partly those drugs are imported, but most of the drugs are available which are generic, which helps to cut the cost. And coming to the latest advances, we can use cellular therapy to improve our transplants, and CAR T cells, as you know, is a reality today. We've all started using it. It's expensive, but definitely compared to the world, I think the costs are a fraction. We are talking of $1 million or $500,000, and here we are talking of 30 to 40 lakhs, which is a fraction. And we are all, most of our centers have started using it, and with good benefit, and I'm sure there are lots more to come. Again, a very important question for a country like ours, which is one of the largest populated countries in the world. I think despite having 115, 120 centers, there is a supply-demand imbalance. And the supply-demand imbalance to be breached has to be an effort by both the corporates and the governmental agencies. And obviously, we have to ultimately be able to meet the demand of a large population, which presently today is, I think, partly unaddressed. I think this has been a great initiative and so well organized. Warm hospitality, lovely, facilities to do the conference, and we all have felt very nice being here. Academically, it's been a very enriching experience. Networking globally, collaborating, opportunities arising, and obviously we see certain gaps that we need to bridge to bring our country to the level of what global best standards are right now. So I think to that effort, this whole huge Apollo conclave has been an excellent effort, and I must congratulate the organizers and Apollo at large for this effort, which I'm sure will bear fruits downstream.